Hello students, today we will discuss about the anatomy of thoracic duct. Thoracic duct is a lymphatic channel and it drains the lymphatic from most of your body part. So, when you will see the thoracic duct, what are the important things which you should know? The first thing is that it is the largest lymphatic vessel in the body. So, this is the first question for your exam. Write down the name of largest lymphatic of the body. Answer is thoracic duct. Then you have the second question from this topic. What is the length of this duct? Now, you have so many structures in the body which are 45 centimeters long, and out of which the thoracic duct is one of that in the list. And if you have the inches, it is 18 in inch. So, these are the two important questions for your exam. Name of the largest lymphatic vessel and second is the length of thoracic duct. Then, when you will see the extension of the thoracic duct, it starts from the upper part of abdomen. So, now this is again the next question, that what is the point of beginning of this thoracic duct? So, it begins in the abdomen and it enters into the thorax and ultimately it reaches up to the lower part of the neck where it terminates. Now, when it is passing from abdomen to this part of the neck, it crosses the two mediastinum. One is the posterior mediastinum and another is the superior mediastinum of your thorax, and it is beaded in appearance. Now, just like you have the multiple motis like pearl-like appearance, and that pearl-like appearance is beaded appearance, and these beaded appearance is because of the presence of the valve, and these valves are semilunar in nature, which are present in the thoracic duct. So, in this image you can see that this is the thoracic duct and this duct is starting in the abdomen, because you will have the diaphragm here and this diaphragm is dividing this thoracic cavity from the abdomen. So, it is starting in the lower part and it in this area, in lower this area below the diaphragm, it enters into the thorax and then it will reach into this part of the neck. So, from this upper part of the abdomen till the neck, you will have a 45 centimeter long duct which is known as thoracic duct. Now, if you will see the mediastinum, as I told you that it crosses the superior mediastinum and it crosses the posterior mediastinum. So, here if you will see the thoracic duct, it is green in color and you can see that the superior mediastinum ends at the level of the T4 thoracic vertebrae. So, here you can see this is the first rib, second rib, third rib and fourth rib. Now, if you will go posteriorly and if you will count the thoracic vertebrae, this is your first, second, third and fourth. So, this is the level where you have the differentiation between the superior and inferior mediastinum. So, this thoracic duct is present in the superior mediastinum as well as in the inferior mediastinum, but in the superior mediastinum, it is on the left side of the midline. Now, this is the important thing to understand whenever you are reading the superior mediastinum. This duct is not present in the right part of the mediastinum, it is seen in the left part of the superior mediastinum. Now, what is the beginning exactly? Now, when you will see the beginning in the upper abdomen, it starts as a continuation of the upper end of cisterna chyli. Now, what is cisterna chyli? It is a sac-like dilatation and this dilatation is present in the abdomen. Now, when you will see in the abdomen, this cisterna chyli lies against the first or second lumbar vertebrae, and that is why the upper end of the cisterna chyli is actually known as the continuation, or it provides continuation to the beginning of the thoracic duct. So, the beginning of thoracic duct comes from the T12 thoracic vertebrae. Now, some books says that the extension may go up to the L2 because it depends or it vary along with the position and it is having the variability with the length of cisterna chyli. So, when you will see the beginning of your thoracic duct, the most of the book we will say that it starts from T12 level, and it is a upward continuation of a sac which is known as cisterna chyli. So, suppose this is a sac and its upward continuation is a duct. So, this point is known as the point of beginning. So, this sac lies against the L1, L2 vertebrae, but this point of the tube starts at the level of 12 thoracic vertebrae. Now, it enters in the thoracic cavity through the aortic opening of the diaphragm at the level of T12 thoracic vertebrae. Now, in this image, you can see that this is the lower dilatation part of your this lymphatic system, which is known as cisterna chyli. Now, from that you have this thoracic duct which starts and enter into the thoracic cavity. Now, when you will see the entry comes through these openings. Now, when you will see the diaphragm from below, you are able to see there are three major openings. This is the one opening, this is the second opening, and this is the third opening. Now, my dear friends, you have to understand that the third opening, that is known as aortic opening, is actually not an opening, it is a gap between the posterior margin of this median ligament of diaphragm and anterior surface of the vertebral column. And that is why this opening is also known as hiatus. So, hiatus is a more proper word for this area rather than opening. So, you have the vena cava opening, you have esophageal opening, and you have the aortic hiatus. Now, through this aortic hiatus, you have the entry of thoracic duct. So, this is the thoracic green color duct, and this duct will enter from abdomen into the thoracic cavity. And here you can see that there is a very big structure is coming out from this opening, that is aorta. So, because of the major origin, major entry of the aorta, this area is known as aortic hiatus, which is actually a gap between the posterior margin of the median ligament of your diaphragm and the vertebral column. Now, in this image, you can see the superior view of your diaphragm. Now, when you will see the superior view of the diaphragm, posteriorly here you can see that this is actually a gap. There is no any puncture or no opening into the diaphragm, because diaphragm is here and this is a puncture in the diaphragm. So, this is not anymore considered as an opening, it should be always remember as a hiatus, which is a gap between the posterior part of your diaphragm and anterior part of vertebral column. Now, here in this area you can see there are three structures. This is your aorta which is going downward, this is your lymphatic, that is your thoracic duct, and this is your vein, that is your azygous vein. So, when you will see the gap posteriorly, you have the three structure: aorta, thoracic duct, and azygous vein. Now, what will happen once it enters into the chest cavity? It goes or it ascends upward in posterior mediastinum first. Now, in posterior mediastinum, initially it lies on little bit right side of the midline, because if you will see this image, this is not exactly in the midline, it is a small bit you will find on the right side. But in upper part you can see that now it comes on the left side. That means at one place this thoracic duct will change from right to left, it crosses the midline from right side to the left side. And when it approaches this superior mediastinum, you will find that it is present only on the left side, the duct is not present on the right side. So, you have to understand that it ascends in the posterior mediastinum, but it changes its direction or it crosses the midline from right to left at the level of 5th thoracic vertebrae. And then it ascends into the superior mediastinum, because you know that the junction of T4, T5 is a plane, above that you have the superior mediastinum. Now, then it ascends upward in the superior mediastinum on the left side of the esophagus, and ultimately it reaches in the neck. Now, in the neck region, it ultimately lies or it make a arch laterally opposite the transverse process of C7 vertebrae above the left clavicle. Now see, you have to understand this concept that the lymph is ultimately going to drain into the veins, and here you have to first keep this thing in mind that this thoracic duct is ultimately going to drain into the venous system, which is present here, is known as superior vena cava. And in the superior vena cava, there are two sources of the venous blood. One is the right and left brachiocephalic vein. So this, your thoracic duct ultimately opens in the left side venous vein, that is the left brachiocephalic vein, which is formed by the union of left internal jugular and left subclavian. So my dear friends, the important thing which you have to keep here in mind in the whole course is the 3 number. What are the 3 number? It starts from the T12, it crosses at the T5 and it arches at the level of C7. So it becomes easy to understand that 12 is the total of 7 plus 5. Now what is the meaning of 7? It is the C7. What is the 5? It is T5, and the total is 5 plus 7, 12. So it is T12. So here you can keep this thing in mind when you are writing the course, that the thoracic duct starts from the T12, it enters into the thorax at the level of T12, then it changes its course from right to left at the level of T5, then it enters into the neck, and in the neck it arches from posterior to anterior side because it is running in the posterior mediastinum. So the arch starts at the level of C7. Clear? So now this it becomes easy that 7 plus 5 is equal to 12 when you are reading the course of the thoracic duct. So what is the termination now? Now this arch, when you see the arch is going from posterior to anterior side, and this arch which finally descends and it lies on the front of the first part of subclavian artery. Because when the arch is forming, below that you have the first part of subclavian artery. Now in this image you can see that this is the first part of subclavian artery and the duct is making arch on this artery. So this is your first part of subclavian artery. Now the duct which is present here is present in the green color, which you can see that it is arching on this area. So this becomes easy to understand that at the level of C7 the arch is formed, and this arch is going from posterior mediastinum to the anterior aspect. And when it is going from posterior to anterior, on the left side it is crossing the first part of your subclavian artery, and then in the neck it opens at the left jugulo-subclavian vein. Now what is that left jugulo-subclavian angle? It is actually a junction of the left internal jugular vein and left subclavian vein. So this is again the very important question for your exam, that what is the termination of lymphatic duct. So I told you that whatever the lymph is there, ultimately it is going to end in your venous system. So this thoracic duct drains the whole lymph from most of your body, not the whole body, most of your body into the left side of venous system, and that is actually the left jugulo-subclavian angle, that is a junction of left internal jugular vein. So here you can see that this is the left internal jugular vein, and here you can see that this is the left subclavian vein. So this angle is known as left jugulo-subclavian angle, and it is here you can see the termination or this opening of this green colored thoracic duct. So now once you are reading the structures entering or passing through the aortic hiatus, you will realize that there are 3 structures. One is aorta, second is azygous vein, and third is the thoracic duct. These all of 3 structures are making arch in the upper part. Now here you can see that this is your azygous vein. Now this azygous vein is making arch in the upper part on the right side, and then it will open into the superior vena cava. This is your thoracic duct which is making arch, and it will open into this left side of the vein, and this is your arch of aorta, which is giving origin to the descending aorta. So, if you will see here in this area, you will realize that there are three structures: aorta, azygous vein, and your thoracic duct. But when you will trace all these three structures in upper part, what you will find that all these three are having arch. Azygous vein making an arch, it will open into the superior vena cava. Thoracic duct is making an arch, and then it will open into the left side of this junction of the brachiocephalus, this internal jugular and subclavian, and the ascending aorta is making an arch, and it is a continuation of the arch of aorta. So, this is the important thing. Sometimes you have this question that which opening of diaphragm consists the structures which all of them are forming the arch. So, these are the three structures which all three are forming the arch. Now, we will see the relations after the course. Now, first at the aortic opening. Now, at the aortic opening, when you will see the relation of this thoracic duct, anteriorly is you have the diaphragm. So, anteriorly is the diaphragm, and more particularly I told you the median ligament, and that is the median arcuate ligament of the diaphragm. Posteriorly you will have the vertebral column, more specifically the 12th thoracic vertebrae. Now, what are the relation on the right and left? Now, you have to keep this thing in mind that the azygous vein, thoracic duct and aorta, these are the three structures in the opening. So, in this opening there cannot be any other structure. Now, out of these three, the one will become right and one will become left. So, how to remember? Now, you know that the azygous vein make a loop or make a arch around the root of your right lung. So, it has to be remain on the right side of the mediastinum posteriorly. So, but obviously on the right relation I will have the azygous vein, while you have the depression, or I should say the impression of your aorta on the left lung. So, this left side you have the relation of aorta. Clear? So, it becomes easy to keep this thing in mind, which you can also appreciate in this diagram, that this is your midline green color thoracic duct. On the left side you have the aorta, and on the right side you have this blue color vein, that is your azygous vein. So, when you will have the structure at the diaphragm, anteriorly you have the diaphragm itself, at posteriorly T12, right side you have azygous vein, on the left side you have aorta. Now, in these two diagrams again you can appreciate that this is your formation of the thoracic duct, and this is your median arcuate ligament, and this is your big vessel, that is your aorta. Now, when you will see above, now what you are able to see in this frame, that there are three structures. On the left side you have aorta, on the right side this is your azygous vein. Here in this diagram, which I already explained that what are the structures in the aorta, that is important to keep in mind, because so many times you have this question in exam. So, right and left relations are easy, which you can remember on the basis of your lungs, that on the right lung the loop is formed by the azygous vein, on the left lung the loop is formed by the aorta. So, left relation is aorta, the right relation is azygous vein. Now, we will come to the relation in posterior mediastinum. Now, when you will see the relation in posterior mediastinum, anteriorly you will have the diaphragm in the lower part. It is not present in the whole length, but it is only in the lower part you have the diaphragm, but in upper part there is an important relation is esophagus. So, this esophagus, if you will see here, now this is the esophagus. Now, in this portion you can see that esophagus is going to convert or continue with the stomach, but here in this area you are not able to see the green color thoracic duct, because the thoracic duct lies behind the esophagus. But this relation is more prominent in the lower part of your posterior mediastinum. As you will go above, you will realize that thoracic duct, we have seen that comes on the left side. So, in most of the course, the esophagus is having the relation with thoracic duct on its left side. Clear? Now, posterior relation we will discuss in the coming slide in detail. On the right side again you have the azygous vein, on the left side again you will have the aorta. Clear? So, the right left relation will not change. in the posterior mediastinum, anterior relation is the diaphragm and esophagus, which are more prominent relation in the lower part. Because esophagus is having the left placement of the thoracic duct in most of its course. Now, in this image, you can see again that this is your vein, which is azygous vein, and this is your aorta. And here you will have the thoracic duct. So, thoracic duct comes on the left side of esophagus, and on more left you have this aorta, and on the right you have your azygous vein. Now, when you will talk about the posterior relations of this thoracic duct, before that you should have the idea about the posterior wall. Now, when you will see the posterior wall, you have a midline vertebral column, and from this thoracic aorta, you can see that the right side intercostal veins are longer as compared to the left. Why? Because the aorta is not a midline structure, it is on the left side. So, the right costal arteries have to cross the midline to reach into their respective intercostal spaces, while the left intercostal arteries are smaller, because they just start from the aorta and immediately they will enter into the respective intercostal space. So, the first thing which you have to understand that the right intercostal arteries always crosses the midline. Apart from that, you will have the two important veins which are having or which are opening here into the azygous vein, that is your hemiazygous and accessory hemiazygous. So, these are the two veins which you can see here, and these are having the opening into this azygous vein. Now, if I will draw my thoracic duct here, so thoracic duct lies here. So, this thoracic duct is present here, and the thoracic duct is overlapping or it lies anterior to your posterior intercostal arteries, but these posterior intercostal arteries are of right side and it is overlapping or lies anterior to the terminal part of azygous, hemiazygous and accessory hemiazygous. So, when you are reading the posterior relation, the first relation is vertebral column, second is right-sided posterior intercostal arteries. Clear? Why? Because the right-sided artery is crossing the midline and the terminal part of hemiazygous and accessory hemiazygous veins. Clear? Now, what will happen in the superior mediastinum? In the superior mediastinum, it lies posterior to the arch of aorta and the left subclavian artery, because it is running still along the posterior wall. You have to keep this thing in mind that the arch of the thoracic duct starts at the level of C7, because we are using this C7, 7 plus 5 is equal to 12. So, when you will reach up to the C7, then and then only it will make a arch. So, up to this cervical C7, it is remain along the posterior wall of thoracic cavity. So, anterior to that, if you will go in the superior mediastinum, you will find this is your arch of aorta, and from the arch you are having the origin of this subclavian artery. So, still in this area you can see that thoracic duct lies behind these two vessels. What are the name? Aorta, arch of aorta more specifically, and the subclavian artery. Now, this is your superior mediastinum. So, you have to understand that this duct is still lies in the posterior part of the superior mediastinum, because this curvature or the arch will start above the T1, that is at the level of C7. Clear? Now, what is happening in the root? So, in the root of neck, now you have to write down about the arch. So, this arch is actually lies, or you can say forward and on the left. So, arch is not straight, the arch will go on the left, because it is going to actually terminate at the junction of left internal jugular vein and left brachiocephalic vein. Now, when it is making an arch, the arch starts behind the carotid sheath. Now, when you are reading the head and neck, you will find that there is a tubular extension present in the neck which encloses the internal jugular vein, carotid artery and vagus nerve. So, in this diagram, you can see that this is the tube, and this tubular extension is known as carotid sheath. Now, in this carotid sheath, on the lateral side you are having the vein, and on the medial side you are having the artery. And when you are making the loop of your thoracic duct, which has to start at the C7 and then it comes on the anterior aspect, is starting from behind this your common carotid artery. So that is actually the lower part of your common carotid on the left side, as well as this is the lower part, or you can say inferior bulb of the internal jugular vein. So my dear friends, it is very commonly asked question in your exam that if there is an injury behind the lower part of the carotid sheath, there is a very high chances of the injury of thoracic duct, because the thoracic duct loop, this loop is actually starts at the C7 and it lies, or its beginning of the loop is behind the carotid sheath or behind the terminal part of the your left common carotid and internal jugular vein. Now then it crosses over the dome of the pleura and the left subclavian artery, and ultimately it enters at the confluence of left internal jugular vein and the subclavian vein. So now here you can see this relation also, that when you are tracing the lung, now this is your apex of the lung. Now you can see that this is the left lung and this is your apex, this is the upper part of the lung. So when this arch is making from posterior mediastinum to anterior mediastinum, it is actually lies above the apical part of your left lung, and on the same time this area or your beginning of the arch is behind the carotid sheath. So in this reason the relation is become very important to understand that there are two structures which are anterior to the loop is your structures of carotid sheath, and apart from that this loop lies on this subclavian artery first part, and it is also in relation with the apical part of the pleura of left lung. Clear? Now when you are talking about the area of the drainage, I am saying this, that the thoracic duct is not draining the whole area. So you have to understand that thoracic duct drains all the part of the body, except there are few areas which will left. And what are these areas? Now this is the question, that structures which are not drained by the your thoracic duct. So these are the areas of right side. Which right side? Right head and neck, right half of head and neck, right side upper limb with the right axilla. Then you will have right chest wall, right lung and the right side of the heart, right surface of the liver, and these all right areas are drained actually by the right lymphatic duct. Now in this image you can see that this is your superior vena cava. Now this superior vena cava is receiving the right brachiocephalic and the left brachiocephalic. Now this left brachiocephalic is formed by the left internal jugular and left subclavian. At this junction you are having this arch of your thoracic duct. Clear? But on the right side you are also having one more duct, and this duct is known as right lymphatic duct. So this is very important question in your exam, which most of the students actually replied wrongly because they don't have the knowledge of this part of your lymphatic drainage. So you have to understand that right side venous system also receiving a lymphatic duct, and this duct is known as right lymphatic duct. So right lymphatic duct opens into the right angle, that is the angle of right inferior vena cava, the right internal jugular vein and right brachiocephalic vein. And the thoracic duct, which is a major draining channel, is having opening on the left side. Clear? So here if you will see the superior view, in the superior view you will find that this is the channel which is reaching on the right side, and this is the channel which is reaching on the left side of the veins. Clear? So whenever you are reading the thoracic duct, you should explain that the right side is also we have having a duct, and that duct is draining limited areas, not the whole area. So the right lymphatic duct is much smaller than the thoracic duct, and it drains the right intercostal nodes, it drains the right bronchomediastinal trunk, it may receive the right jugular and subclavian lymph nodes. So, it opens at the commencement of the right brachiocephalic vein and into the right jugulo-subclavian vein. Clear? So, whenever you are writing the thoracic duct, you should always have this brief introduction or the part on the right lymphatic duct. So, right lymphatic duct is also having the lymph nodes of the right intercostal areas and the right bronchomediastinal lymph nodes, and it also receives the right jugular node and right subclavian nodes. Now, at the end so what will be the tributaries for your thoracic duct? So, the thoracic duct, if you will draw the body, you have to understand that this is the diaphragm, this is the thorax, this is the abdomen. So, the thoracic duct is draining the whole area below the diaphragm. That means it is draining the both lower limb, it is draining the whole right and left half of the abdomen. So, it carrying the lymph from the lower half of the body below the diaphragm. So, below the diaphragm, this whole area is drained by the thoracic duct, either it is right or left. But if you will see the upper part, it courses through the thorax and duct receive lymphatics from the posterior mediastinal and left intercostal nodes. That means it is not draining the right upper limb, it is not draining the right part of the lung, it is not draining the right chest wall, it is not draining the right surface of your heart, it is not draining the right side of head and neck. So, this small part of the right side is not drained by the lymphatic this thoracic duct. The remaining all this part is drained by your thoracic duct. So, in the neck, when you will see the arching part of your thoracic duct, it is having the three very important tributaries. One is the left jugular lymphatic trunk. Now, this left jugular trunk is carrying the lymph from the left half of head and neck. The right half will go in the right lymphatic. Then you will have left subclavian. Now, this left subclavian lymphatic trunk drains the left axilla and left upper limb, and the right will go in the right lymphatic. Then you will have the left bronchomediastinal. Now, that left bronchomediastinal is draining the left lung and the left side of the heart, as the right heart will go into the right lymphatic duct. Clear? So, sometimes you have this multiple choice question in your exam that which of the following area is not drained by the thoracic duct. So, you have to understand that below the diaphragm, either it is right or left, the whole part is drained by the thoracic duct. But this right and left confusion will come above the diaphragm. So, where you will have this right half above the diaphragm, that means your right upper limb, right axilla, right supraclavicular area, right head and neck area, the right part of the thoracic thoracic wall and the right surface of the heart. So, that is actually draining into the right lymphatic duct, which will open into the right brachiocephalic vein. So, this become very important to understand the difference between the drainage of your thoracic duct and the right thoracic duct. So, in these images, you can see that this is your right lymphatic duct and this is your main thoracic duct on the left side. Now, what are the important clinical anatomy related to the thoracic duct? So, thoracic duct sometimes will get damage into the posterior mediastinum, and if there is a damage occurs, there is a collection of the lymph or the chyle into the pleural cavity, and that is known as chylothorax. And it may occur due to the rupture of thoracic duct caused by the trauma, tuberculosis and malignancy. The second applied is thoracic duct fistula. Now, fistula means there is a small leakage occurs, and this leakage of the lymphatic fluid from the thoracic duct due to the surgeries in the root of neck. Now, you have to understand, I am saying this again and again, that in the root of neck, it will injured only when you have some procedure on the left side, not on the right side. If right side the injury will occur, then the cause is not thoracic duct, then it is right lymphatic, which is actually your area draining in the right side of the body above the diaphragm. Then the third is obstruction. Now, obstruction of thoracic duct may occur with the parasitic infection by the microfilaria wucheria, rank of thigh. So when the infection of the microfilaria will occur, the patient will have the filariasis. Clear? So that is the one of the cause of the obstruction. Apart from that, the obstruction may occur because of the external pressure caused by the tumors or the malignancies. Clear? So now at the end of this class, now we have the idea about the thoracic duct, the area which are drained by the thoracic duct, the area which are not drained by the thoracic duct are more important to keep in mind. What is the course? What do you mean by the 7 plus 5 is equal to 12? So you have to keep the course in mind, that it starts from the T12, change the direction at the T5 and it make an arch at the C7 and ultimately it terminates into the left side. Clear? So this is all for today's class. Thank you.